So we're going to look at assessment of sacral nutation for anytime there's any outside force that comes through our system. We should have some stabilizing contraction to counteract that, okay? So what I'm going to have Kelsey do is she is going to hold the dowel basically into a corner, something that's stable that she can press into. We're going to have her offset her feet a little bit. And essentially what should happen with sacral nutation is the sacrum, when there's that outside force, the sacrum should have some ability to nutate or move anteriorly on the innominate. Okay, so I'll have a manual contact on PSIS and a manual contact on the sacral base, and I want to feel as she turns on her core by pressing that dowel into the rod, does the sacrum actually move forward or not? Is that there an automatic stabilizing motion of sacral nutation? All right. If there's not, or if the sacrum wants to actually move back, that's relatively, the theory is that that's relatively moving into a more unstable position, which is not what we want. Okay. So if it doesn't move, or if it moves posteriorly, that's not what we want. All right. So now I'm on PSIS, I'm on sacral base, and I want her to go ahead and engage into the wall and let it go. And you're not going to be able to see much here, okay? You're feeling with your hands. You want to sink into the level where you can actually feel what the sacral base is doing, and go ahead and engage again and let it go. And she does nutate on this left side. There is a forward motion there. Now switch there. Good. So now I'm going to come PSIS with my right thumb. Sacral base is just superior medial to PSIS. So I'm there, and now I want you to go ahead and engage. And she's trying to find it and let it go. But she is, and then go ahead and do that again. She's actually getting some extension moment of her lumbar spine here, which isn't allowing a translation into sacral nutation. So there's some inefficiency here on this right side that's not allowing stability. And so what I would want to know from this is like, okay, the answer to this test is, you bring the dowel rod down. The answer to this test is there is not sacral nutation here. Now when we go to treat that, will be the next video, we'll get her on the table, and I want to see if I block the front of her pelvis, is there an actual hard infill there, or is this a motor control issue? Okay, where if we can get L4-5, L5-S1, better initiation, can she then translate to where she can nutate through her sacrum? Okay, so that's kind of the differential there. So the next video will be the actual, well, I guess it'll be assessment to see if there's a mechanical restriction that's not allowing that nutation or not, if we need to work on more motor control.